Good afternoon. My name is Rachel Logan, the Training and Technical Assistance Manager at the National Center for Health and Public Housing, and today I'll be presenting Identifying Healthcare Needs of Aging Populations with Data with Joy Oguntumen, who is also the Health Research and Policy Analyst for the Center. We also conducted this presentation or planned this presentation with Johnette Payton, who is the Health Promotion Project Manager, but she is not able to present today. Here at the National Center for Health and the Aging, we provide training and technical assistance to health center programs in the United States that serve aging populations. So this can be your 65 plus or potential populations who are moving on into that aging phase. So really focusing on the issues underserved older adult populations face, from your chronic disease to your mental health issues, accessing medical care, obtaining benefits and access to those benefits like Medicare and Medicaid, as well as nutrition services and various aspects like that. So helping health centers realize everything that older adults need to live well. In the U.S., the aging population, people 65 years and older, represent about 12% in the year 2000. And that population is expected to increase about 19% by 2030. And so really focusing on this population is critical and crucial, especially since the older adult population is diversifying. And so you have more minority populations and other underserved communities within the elder population. It's also important to address specific needs in this population, such as public health aging policy. So addressing those policies that will affect older adults and planning for those changes. The objectives for today's webinar are to identify various data sources on the federal, state, and local levels, as well as generate maps that will be used for the service area competition grant, but it can also be used in other funding opportunities, so demonstrating these medically underserved areas and populations, and understanding how data can assist with the service area competition grant. We consider healthcare data to be crucially important because it demonstrates the need of particular populations as well as underserved communities. And for aging adults who may be isolated and live independently, it is critical that we identify where those pockets of people live, where they are accessing care and other things that can affect their lifestyle and their wellness. So getting this information and being able to demonstrate it in a numeric form drives funding opportunities, drives policy changes, and also drives programs and services. There's a lot of things that you can do with healthcare data. One of them, as I mentioned before, is identifying these health disparities. So where are the older adults who are disabled? Where are the older adults who aren't getting medical care? Are older adults being screened? Where are the Hispanic elders or other immigrants in the elder or in the aging population? So identifying those various things. Also showing this medically underserved area. So are older adults getting the care that they need? Are they living in an area where they only have a hospital, so they only have the emergency department available to them? Or are they living in an area where they have their choice of healthcare providers that are specific to serving older adult populations? And also measuring the success of program goals and objectives, which is very important for health centers because HRSA sets goals and objectives for health centers, as well as monitoring their monitoring how well they're serving their patient populations. So when you set up a program, you want to make sure that you're hitting those targets. Are you helping patients better monitor their diabetes? Are they now exercising better hypertension control? Different things like that, and data allows you to follow those trends and to meet goals and objectives. During the planning process, the first step that you have to do is meet with your population and identify the needs. And through that, you can identify desired outcomes. So do you want 20% of your patient base, or if you're older adult patient population to control their hypertension better or manage their chronic health condition. And once you do that, you have to put that into a planning model and implement that on through, as well as create smart objectives. So specific, measurable, attainable, reasonable, and timely objectives, which are very realistic objectives that you can actually achieve. And also assess your resources. So what are some of the things that you have in your communities, that you have at your health center that you can use to achieve these? Data allows you to identify what you have and to also plan for the future as well.
Now we're going to talk a little bit about a few data sources that you can use on the federal and local level. So as mentioned earlier, the general consensus is that when we are talking about the aging population or older adults, that is those who are 65 years and older. In 2009, there were about 49 million older adults, and so this is clearly a growing special population. The main source for the federal data would be the Administration on Aging, also known as AOA. AOA brings together several different resources that provide statistical information about older adults. We've listed just a few here, and combined, these resources provide information on income status, health status, educational, employment status, disability, and even living arrangements. So who are these older adults living with? Sisters-in-law, daughter-in-laws, daughters, sons, that type of information. The profile for older Americans is a great starting point if you just want to begin to paint your picture or just get a scope about older adults. This profile essentially is a brochure with the latest general data about the aging population. It's available as a PDF, but you're also able to download the charts and the graphs included in the brochure as an Excel file. Another great resource is the Aging Integrated Database, also known as AGID. This resource doesn't necessarily tell you about the aging population, but more so tells you about programs for the aging population. So you're able to map and receive tables and charts that tell you what states are offering certain programs and how and if older adults are accessing these programs. The additional resources listed, such as the census and the key indicators of well-being, are additional brochures or files or online data tools that you can use to learn more about the aging population. I just also want to highlight the minority aging tool, which is very great because this growing population is very diverse. And so the minority aging data resource is good so you can begin to break down certain health issues by race and see what is more prevalent by race and ethnicity. The HRSA Uniform Data System, also known as UDS, is essentially a database where all health centers report their information. For those of you who work in health centers, you're probably familiar with UDS. For those who are not, UDS essentially collects information about the age of patients, race, ethnicity, services offered by health centers, the clinical reporting such as how many people are diagnosed with diabetes or high blood pressure, how many patients had various immunizations such as the flu or TB. And it also provides you the cost of those services and the cost of running the health center. The UDS data, I do want to point out, only reflects information about health center patients. So it only reflects the health and health use patterns of patients who go to health centers. It is not national in terms of everybody who's going to a private practice or a hospital. It is just for health centers. The UDS also collects information on the best languages used to serve certain populations. So as we all know, the United States is becoming more diverse. you're having more immigrants come in from all over the world, and so UDS is starting to also capture the languages that best serve these populations. And with UDS, you can download the data into Excel that you may need to create graphs and charts of your own. UDS Mapper is another really great resource. For those of you all who are interested in applying for grants, oftentimes grants will require you to provide a map of your service area. And if they do, UDS Mapper is a great tool because it helps to capture the work that health centers are doing. UDS Mapper is a free resource, and it's available to anyone with a current email address. The cool thing about UDS Mapper, too, also is that while they have their own data on health center and where health centers are located, low-income population penetration, it also allows you to upload your own data and create your own map. A few key things that you can use UDS Mapper to do is identify underserved areas for outreach. You can identify high-risk areas that you may want to target. And while we're still, while HSS is still promoting enrolling people in the marketplace, you can use UDS Mapper to identify areas with high uninsurance rate and target them for outreach and enrollment. I believe we still have until January to enroll, and so it's still a great resource that you may want to use. This particular map right here shows the low-income populations not served by health center program grantees. So the purple areas are showing you are the areas where health center program grantees are located, and the red, these red spaces show medically underserved areas and populations. Rachel will talk more about the UDS Mapper in her part of the presentation. So we talked some about federal resources and even a little bit about the state resources. And now when we talk about local resources, that includes state, county, city, or your particular place of practice, whether that's the private practice, the health center, the hospital, or anything similar. The importance of local data sources that it really helps to fine-tune this picture that you're creating about your population, about the program that you want to do, and the people that you want to serve. So you start off with your federal national service, which kind of is your background, but when you start to narrow in and go on collecting and looking at local data, you're able to fine-tune and really create a great masterpiece. The local data sources, as this diagram shows, help us to gather information, analyze the data that we have, identify patterns and issues, and discover solutions and programs that best serve our population. With local data sources, we're able to identify unmet needs, the prevalence of various problems, gaps in service, and barriers to care. One great resource that you may want to consider using is the Agency for Health Research and Quality database. They provide information on a variety of health topics such as hospital discharge records, so the demographics of who was admitted to the hospital, the cost of health care, uninsurance rates, who was discharged with certain groups of medications, and that type of information. And it's available from a national level to a local level. So that is a great resource. As many of you may know, many healthcare providers have switched to using electronic health records, or commonly known as EHRs. EHRs are a great resource for local data source because they are particular to that area of practice, whether it's a health center or a privately owned doctor's office. With electronic health records, they collect information of age, race, the zip codes of where people live, so those type of demographic information. Additionally, they have your clinical information, such as what lab tests were ordered, what were the test results, immunizations, diagnosis, number of visits, that type of information. So when you're looking to fine-tune and get your local data source, EHRs are a different source, are another source that you can use. Now we're going to Before we move on, we wanted to talk about online data queries. So for those of you who are thinking, all right, these are really great resources, I can download them, but if I'm able to download the data and I don't know how to use SPSS or Stata, how do I get the information that I need? The great news is that many of these resources also have online systems or online data queries where you can quickly type in a search term that you want or the type of data that you want, and you can get the facts and the figures instantly. These are resources, in addition to those mentioned earlier, you have county health rankings, you have the Behavioral Risk Factor Surveillance System, also known as BREFAS from CDC. The Census Bureau has an online data query system, and several other federal and national data resources allow you to find the information that you need online without having to download the raw data. This is great because these online systems don't just give you a number, but they also often help you generate charts, graphs, and maps of service areas. They help you to see national trends and identify perhaps social determinants of health that are affecting your population. And now I want to show you about another tool that you can use known as Community Commons. So Community Commons at www.communitycommons.org is a mapping tool similar to UDS. The difference mostly is that Community Commons has more databases. So what the people at Community Commons have done is they've taken a variety of data sources such as the U.S. Census Bureau data, American Community Survey, the BREFAS mentioned, the Housing and Urban Development Resource, and compiled it into one big database, and then they've merged it with a mapping software so you can map the data and see it geographically. So once you get to Community Commons, you click on Maps and Data. And Community Commons is in the process of developing a new way to map, which is the MapRoom Beta, but there's also MapRoom Classic. Both work similarly the same. Today we'll focus on MapRoom Beta, but MapRoom Classic is also very easy to use, and you can get the same maps that you would in MapRoom Beta. So you click MapRoom Beta. It'll ask you to log in. Registration is free, and then similar to UDS, Community Commons is available to anybody with an email address. So you want to search for what you're looking for. So today we'll search for disabled population, because that is becoming a new growing topic as it relates to aging population and in healthcare, taking care of those with disabilities. When you search for disabled, Community Commons will show you what data sets they have available, and you're allowed to select which one you want to graph. The will graph the most recent data, and we're interested in the aging population. So we'll select disabled populations, age 65 plus, ACS, which is American Community Survey for 2009 to 2011. Now, if you're not familiar with data sources, Community Commons allows you to select info to learn more about the data source. And as you see here, it gives you a description of the data source, when it was released, and then additional information about that data source. So if you don't understand the abbreviations, that's not a problem. Community Commons allows you to search for it. We'll select Add to the data, and Community Commons will generate a map for us. As you can, while the map is generating, I just want to highlight that you have different layers that you can add to your map if you want to highlight specific geographical features. So as we see here, this is our map of the disabled population by percentage of those who are age 65 plus. And over here will appear, as it is appearing now, your legend, so you can understand, so we can understand what the different shading of green means. You can get If you're looking, again, to start nationally, here's your big map. But then you can also narrow in by clicking the zoom button on the left-hand side of the screen. Or if you know exactly where you want to go, you can type it in. So we may want to look at Virginia. Type it in, and Community Commons will zoom in there for us, and we can see it broken down by county in Virginia. There are additional tools that you may want to use for your map, and you can save it if you're interested. And then the good thing about Community Commons is that it is a community of researchers and health professionals, so you can also share it if you're interested in starting maybe an online forum on a particular issue and getting ideas and talking more about the data that you're interested in. We will now return to our presentation, and Rachel will talk to us about the service area competition grants.
Thank you, Julie. So for the service area competition grants, it is the grant that allows you to expand services to either a population or to a particular geographic area. And so I'll go through some information that will assist you through this process. To start off, I would just like to say that we have a technical assistance manual available on our website that identifies some of the changes to the service area competition grant. And it also highlights the main components that you need to include. So your service area map, as well as the accompanying table that you get through UDS Mapper, community characteristics that you can generate through UDS Mapper or through some of these other data sources that we have identified today, as well as demonstrating the healthcare need. And so selecting that particular area or identifying a particular population who you would like to extend services to. And so Joy covered a lot of this, but these are some of the ones I'll focus on as well. UDS Mapper is just your go-to source always. And for older adult populations, you may have to kind of switch up some of your data sources and use different data queries to really capture that 65 plus or that aging population. So ACL and AOA are excellent data sources to use for that. For this example that I'm going to demonstrate, I just wanted to select a particular area and then kind of figure out where the need is, what's this population, what are some of the issues that they face. So initially I went to Community Commons, which is what Joy just demonstrated, and I just wanted to select a population of older adults who are or do identify as a minority. And once I went there, the whole entire map, showed different shades, and I saw that in this area of New Jersey, a lot of the state actually has aging populations. And so I kind of highlighted that and then zoomed into it, and I identified Passaic County. And I looked and saw that in this particular area, over 13% of that population is 65 plus and minority. And so I know that may indicate areas where they may be underserved or they have specific needs. To follow up with the same area, geographic area, I wanted to identify the health centers that are in that area and serving throughout the state of New Jersey. So I went to Uniform Data System, UDS, and I looked at the individual health centers in that area. And so there's a selection that you can make, and it'll pull up all of the 1198 health centers in the U.S. And you see here how many health centers there are in New Jersey. What UDS also provides is information on specific diseases and conditions that these populations are facing. So I see here that health centers had a change in the number of cervical cancer screenings they had. They also actually had a change in childhood immunizations and different things like that. Here we see that there is an issue with adolescent weight screening, as well as in 2011 there was an issue with adult weight screening and follow-up. But currently in the most recent data in 2012, when we look at the complete right-hand side of the adjusted quartile ranking, we see that the tobacco cessation counseling for tobacco users was in the 4th quartile. So it may be an issue in this particular area. So using UDS to highlight some of the issues in your area and using that data to really drive home the need in this particular population, in this particular area, is important. So this is not specific to age, it's specific to an area, but you can kind of tease out some of these variables and factors in order to indicate the need. Continuing with Passaic County, I see that in UDS Mapper that there are underserved populations in this particular region of New Jersey. So the shading on the map indicates the health center penetration of low-income populations. Here we see that Passaic County has about less than 20% health center penetration of this low-income population. It has some coverage as well as a hospital presence there. But there are other regions such as Garfield and Hackensack that have higher penetration of this low-income population. And then South Hackensack has about 60 to 80% penetration. And so that's fairly high, but this may indicate, since we saw in the previous map, that there's a high elder and minority population, and then we see that there's a high need in this area for low-income populations to receive care from health centers, that we now see this overlap that we can indicate in grants and funding opportunities in various aspects. When you click on the data table, and I'll demonstrate all of this later in the presentation, you see some critical data. And so it's about 17% health center penetration in this region of Passaic County, and almost 70% in South Hackensack. And so there's a disparity here where one penetration is receiving a lot of care from health centers and another population is not. And you have to kind of account for that, as well as some of the demographic data that we can collect from here. And so you see with the Hispanic population over here, when you move a little further to your right, it's about 70% Hispanic in this particular county. And so you might want to account for that in your grants and your application by indicating this is how we're going to address this need, this is how we're going to reach out to Hispanic populations in this area and really serve them and provide specialized services and culturally competent care. I also used another resource to give me some of my community characteristics. So I got some demographic data from UDS Mapper, but I need some additional information to accurately assess what's occurring in this particular region. So I went to AGID and put in my area. So you see that this is the state of New Jersey, and I'm looking at specific services that are offered here. So you see this table shows the person served in the service units. So you see here that for personal care, only 122 people were served in 2011. So there may be some indication that older adults are suffering with personal care, or disabled persons are suffering, as well as with adult daycare, only 312 people were served. In the state of New Jersey, they seem to be doing pretty well with home-delivered meals. And so maybe you need additional nutrition assistance because of these home-delivered meals, but what are they eating when they're not always getting the food? And below, at the last variable here, factor, you see nutrition education, there's no data collected. So maybe using that to understand how older adults or this particular population in this region are getting the nutrition information that they need to live better lives. So using some of this other information to gain a greater picture and to really paint a bigger picture of what's going on in this region. Also, to the right of this, you see here is different area agencies on aging, and they are identified in these various counties. And so maybe partnerships that you can propose or information like that that you can use to highlight some of the people or organizations that are serving your population or that are absent from serving this particular population. So you see here there is one area agency on aging that they can access in Jersey. Using county health rankings to identify some specific health behaviors or health conditions that this population face is really important and fairly easy to do. So when you go to county health rankings, you can put in your particular area of interest and highlight this box right here, which says areas to explore. If you click on, that orange will appear on this table and indicate some of the health priorities or the crucial health behaviors that need to be focused on. So you see here in the nation, 13% of adults are smoking, whereas in this particular county, 17% of adults are smoking. So how will you address this particular issue? Will you extend your tobacco cessation services and counseling? How will you reach this older adult population and encourage healthier behaviors? How will you address that? As well as adult obesity and physical activity, which physical inactivity, is much higher than the national average. So will you partner with health centers and get older adults active? Will you incorporate specific health practices and things like that? Using the county health rankings, community comments to generate a community health needs assessment is another tool that you can use to gain a lot of information with a little bit of work. So it's really nice feature that you can tap into and utilize. It contains some demographic information and also will account for some clinical care measures that may also align with what you're recording in your EHR, what HRSA is requiring of you to report, and EHB, different things like that. And so using this to get the state, the county, and other information that you can compare. And so here in Alachua County, you see that they have the county, the state, and the U.S., and really comparing this and showing the need in this particular population and in the region and area. So I will go ahead and demonstrate how to use UDS Mapper. And so as Joy mentioned before, all you need is a current email address. You can go ahead and log in if you already have yours. And so, it kind of already comes up because I had it saved from a previous time. But, excuse me. Let's zoom out a bit. Okay. So automatically, the basic level that is always present on the map when you sign in is the low-income, the health center penetration of low-income populations. That's the main feature that they have available. Excuse. This is acting just a little bit slow, so let's see. It'll load in a second. There we go. So that's the map of the United States. So let's just start fresh. And so UDS Mapper is an excellent tool to understand the exact areas of need. So comparing where your health center is to surrounding health centers or focusing on specific need in populations is very useful and can easily be done through the UDS system. So we'll hit go after I type in my area of interest, and here we see it. When you select, so this gives you a lot of information. When you roll or scroll over it with your mouse, this little box pops up with a lot of data and information about the penetration of the low-income population, other health centers that are in the area that are serving this particular region, and how many total population. So almost 70,000 people live in this county. When you click it, it's highlighted, and you see here it ends up in your selected ZICTA box. And so a ZICTA is a zip code tabulation area, and it is used to as a area where you can geographically assign different data to. And it's important for you to click this so it will appear here because it will also be added to your data table, which is a required component in your service area competition. And so as I mentioned before, I was comparing these two regions to say why are these regions served and this one is underserved. And there may be various factors, but if you're interested, then you can say, oh, I would like to expand services here to this population, and you would list your reasons for doing so. So we'll go down here, And we want to see the health centers that are in this area. So we'll click the health center service access points. We'll also click for the different sites, and we'll click for rural health clinics and facility employing HRSAs excuse me, and hospitals in the area. And so we have a map of all the service providers. So let's click that one too. And when we roll over this particular point, we see that the North Hudson Community Action Corporation, which is acting from NHCAC Health Center, is located here at this particular location. What we're going to do is get our tools, get our drawing tools, and we're going to map out this actual area. So I'm going to get my line tool. We'll change the color to black, and you need to just trace basically this particular area because this is my proposed area of service. So I'm not going to do a perfect job, but just to give you an idea, you have to outline your service area, proposed service area. And so there we go. Also, what's required is labels. So I said this is NHCAC, so I need to go ahead and label that. And so we'll just click on label, we'll release the click button, and we'll just type in NHCAC and hit enter, and it appears on your map. My actual location is right here. So I'll say proposed site. So that's where I want to extend services to this particular site. So I have to label that as well. And then you don't have to label the hospital, but you do have to label all of the health providers in your area. Let's check out what has appeared in our data table. So I selected this particular county, and all of the data that you saw earlier in the presentation has appeared again. This is required, and you have to go ahead and download it when you download your map. So I'm trying to just do a quick demonstration of everything that you need, but you have to, let's go to print, and it'll come up, and so you see in your print window it says include map, but you also have to select include your data table, and just a title, and you can just easily PDF it, save it to your computer, and there you are. If for some reason you can't finish your mapping or selecting your area, you can always save it. As you saw before, it kept the previous information in my system even when I logged out or when I just exited out of my window. So you can have it for later. There are other features that you can use to change it if you want to look at other aspects. So like I said, health center penetration of low-income populations is the basic one that just always appears when you come into UDS Mapper, but you can change it to other demographic or other map layers. And you also can see here some type of statistics that you can pull out that may be relevant to your application, but this is the most basic. I will go ahead and return back to our presentation. And as we're wrapping up and summarizing, just realizing that data can be used throughout your health center's management, throughout health center administration is very important. And so when you do presentations at conferences and you want to highlight what your patients are seeing, what is presenting at your health center, you need data in order to do that. So extracting information from your EHR, using UDS Mapper to highlight some of the issues that your low-income population is facing, some of what your older adult population is facing is important. Putting information out for abstracts and publications gives you visibility, which may also include funding opportunities and various aspects like that. And then specifically adhering to the conditions and regulations in grant applications. So a lot of grants, you really have to show need, and the only way you can really show that is through numbers. So utilizing data in all respects is critical to really obtaining funding through management of resources, to health outcomes at your health center, how many staff you have there, how effective your programs are you meeting goals and objectives. All of that is a part of your grant application. And so recording all of that is just as important as extracting that information. And so you have to make sure systems are in place to accurately record information. It's okay if you have a question in your EHR that accounts for if people feel like they're managing their diabetes, or if they feel like the case manager is handling their cases well, or that's fine. But if you don't have it systematically in place for health centers or your staff to ask and accurately record that and to not skip it or omit it, then it's going to be a problem in the end when you try to extract that data. So accurately filling out your EHR and recording and monitoring health conditions is just as important as just, pulling out some numbers for a grant application. Also with the program planning and evaluation phase, taking out the time to assess the need. So through the service area competition grant, what they really want to focus on is how are you assessing the need for extended services and care. In order to do that, you have to have a good concept of that need. And so using geographic data to identify pockets, but also getting that big picture of those community characteristics. And so understanding your community and demonstrating that through your knowledge and your conceptualization of how to use this data to present your argument or your issue. And then moving into evaluation, using that data to really drive that end result and determining if your program, if your service, if the outcome demonstrated efficacy. Was it effective? Was your program in line with what you planned? All of those different things. And as I mentioned before, monitoring and surveillance, which are just crucial aspects of data collection, especially in the healthcare setting where you have a lot of outcomes that need to be monitored. So accurately monitoring your patients' diabetes, accurately monitoring their hypertension, all of those things, medical or medication adherence, different things like that. So it doesn't always have to be a strict clinical outcome. It could be something like coming to their mental health meetings or accessing healthcare services, using enabling services. That is all data that you may want to record, because when you go up for funding opportunities, how are you going to demonstrate that you're doing what you said you're doing? To compile all that information that we just demonstrated earlier, here's just a brief example of how to write up some of that data. You have all these numbers. How do you put it together and paint this really nice picture of the need in this area or in this population? And so we have an example here from the city of Breskin, Nebraska, and we're highlighting the number of older adults or people 50 and older in this particular community, as well as how many people are living in poverty, and some of the issues as the population, the primary care physicians, the ratio here is fairly high, and comparing that maybe to some national statistics we have, maybe some statewide statistics we have, and so compiling all of that data and information into a nice package.
So we'd like to thank you very much for joining us for our Health and the Aging webinar. In conclusion, we just want to again remind you that when you are able to identify the healthcare data resources and use them properly, it can be a great tool, not just for planning programs, but also for applying for grants, as we said. Using data sources can help you through all phases of the program planning process: planning, implementation, evaluation, again, for also applying to grants. We have several resources here at the National Center for Health and Aging that can help you, including this webinar. We also have a few monographs, fact sheets, which are just tools that we've provided based on data about particular health topics and issues that you might find useful. And these are, again, a few additional resources that may help those of you applying for grants. We will now have a question and answer session.
So if you would like to ask a question, please submit it through the questions box on your control panel. And if you are dialed in through your telephone and would like to verbally ask the presenter a question, use the raise hand icon on your control panel and your line will be unmuted. So right now I don't see any questions in the queue, but definitely check out our website at healthintheaging.org. We have a lot of resources available to assist you. We also do personal one-on-one training and technical assistance. If you need someone to walk through some of those steps with you, we're more than happy to assist you. We also can help you find data sources because sometimes health centers have very specific data requests. And so using that to, sometimes they have very specific data requests, and so we can pinpoint places to get data or resources from, maybe link you to people who have the answer or the information that you need, maybe some contacts or partners that we have that we can link you to. And so if you have anything at all, we're more than welcome, or you're more than welcome to contact us for assistance. Sorry. Hold down. So we still don't have any questions. I guess me and Joy did such a good job covering the material. But also you can join our mailing list if you need to. You can just join that. We have newsletters that goes out. We also submit funding opportunities, so just to get those updates on funding opportunities is very helpful. We also tweet, so follow us on Twitter, and we have our own channel on YouTube, so that information is also helpful. So even though you may not have questions now, you can go back to this webinar, which will be published and also sent to you afterward with information that's helpful to you.
I also, Rachel, just wanted to mention for those on the call that another way to get in touch with us or to receive training and technical assistance is at our annual symposium. The National Center for Health and the Aging will be having our symposium June 9th, 2014 in the Washington, D.C. area, specifically Alexandria. So if you would like more information about it, you can go to www.healthintheaging.org. And currently we're running a holiday special, so you can register for $50. Again, that's our National Symposium, June 9th, 2014, here in Alexandria, Virginia.
Yeah, so that's an excellent opportunity to either meet with us, get some personal one-on-one assistance, as well as learn from your peers and other subject matter experts in the field. And that discounted rate is 50% off, so it's an excellent opportunity to save some money and get additional training. So here are some of our contact information. You can feel free to contact anyone that's listed here for any type of assistance or any information. We all respond to our emails and fairly friendly people, so don't feel shy or bashful. And we're just more than happy to help in any way. Okay, so we do have a question that has come up. Someone asked, you mentioned something about a service area competition grant. What is that? So the service area competition grant is a funding opportunity through HRSA, the Health Resources and Services Administration, which allows health center programs to extend services to particular populations or to specific areas. So you may already have a health center, but you want to, or you know of a need in another area, so you need additional funding to provide those services. Right now, health centers have to meet certain requirements in order to apply for that funding, but we can link you to that if you want additional information, or you can check our website to get that link, because we have a funding opportunity announcement. And also, the next question is, within county data, can the databases mention pinpoint to specific geographical areas within the county? Unfortunately, some of the data is a little limited. So when you have map layers, you may have it at the national level, so that's the United States. You may have it at the state level, so that's just data that's state-based. Or you can break it down into, as I mentioned, ZICTAs or zip codes. And sometimes ZICTAs and zip codes are interchangeable, sometimes they are not. But it really depends on how that data was collected initially. So if you're surveying populations and you're asking them where do they reside by their zip code, then you can pinpoint that data. So if you're asking somebody about what do you weigh and then where do you live, you're able to link certain amounts of weight, or okay, this person is obese, and that's how you get that obesity data. But if it's not collected on a smaller scale than that zip code or county level, then it may be unavailable. So it really depends on what kind of data you're looking for. So for most of the data sources that me and Joy use, that zip code data is available, so you are able to get under that county layer. But like I said, it really depends on what you're looking for. We're going to wait just a couple more minutes for any more questions to appear in the queue. Okay, well, once again, as I said, if you don't have questions right now, then you are more than welcome to contact us later on for any type of technical assistance, any type of questions related to data or funding opportunities. We will be sending these slides out through email after this webinar. Please remember to take our post survey, as that data is very important to us, as we indicated how important it is earlier. And thank you for attending our webinar today.
Thank you.